So thank you everyone for joining us today on this important discussion on navigating disability inclusion in transition of care services. On behalf, I'm Dr. Kavita Magnani, serving as a National Coordinator for India Alternative Care Network. And on behalf of India Alternative Care Network and Changing the Way We Care, I welcome you all in this important discussion. So before we begin our discussion today or this session formally, there are some safeguarding things that we want to inform you everyone. So in compliance to our safeguarding policy, I would request all the participants and the speaker and panelists to not to disclose the name, identity, or any kind of information about the child or the family which may disclose their identity, and also make sure that you maintain the confidentiality and privacy of them. Please introduce yourself in the chat box and keep your mics off during when the session is in progress so that there is minimum distraction. And also you can share if you have any comment or question or any concern or feedback about any session, you can use the chat box to share it. We will definitely address them during the question and answer round at the end of the sessions. We also have two sign language interpreters with us today, Mr. Saurav and Ms. Stuti. They will be here to navigate to help people who have joined, who are people with hearing disability or hearing impairment for them. And make sure your conversation is at a pace so that it is easier for them to do the sign language interpretation. And as far as possible, please do not use any acronyms or any word, or make sure that your words are very clear and it's easy for them to understand and then interpret. So thank you again for joining us today. To have this discussion with us today, we have Miss Beth Bradford from Mistral International. She's a senior technical associate there. And Miss Radhika Alkazi from Asta organization. She's a co-founder. Beth and Radhika ji will be taking us throughout the session. They are the technical associate today. And the session will progress in the following manner. We'll have a first agenda and context setting, that why we are having this session and how the transition and disability needs to be looked into a manner that they synchronize with each other. And Miss Beth will be taking us will be doing the context setting. Then we will be going to the understanding the landscape of disability, the definition, what the law says about, what are different models and how these models have evolved over the years, and what are the international frameworks, what are the Indian frameworks and laws in disability. For that, we have Ms. Radhika Alkazi to walk us through this. We'll be also talking about some of the principle of protection and care for children with disability, and how disability impact the transition. Disability also impact the families and children, and the what are some of the government policies around it. So Radhika ji will be doing this session for us. Then we'll be moving towards an inclusion in transition of care services, how important it is to include children with disability in transition, how their transition would look like, what are the things that needs to be kept in mind when you are rehabilitating the child back to the families, and what kind of a support is required to the families and children to make sure that the children remain within the families and there is no reinstitutionalization of the children. And Beth will be taking us during this session. Then we will be having a panel discussion. For the panel discussion, we have two more people to join us, Mr. Nipun Malhotra and Ms. Seema Chadha. Beth will be giving the introduction there during the panel discussion. And at the end, we will be having a question and answer round to have your queries, question. And in between, if you have any question, please feel free to put it on the chat box so that we can take it up during the session. So again, welcome you all. I would request to have a lot of interactions and question, use chat box, and just make sure that there is less and less disturbance during when the sessions are in progress. So please make sure your mics are off, but you can keep your videos on if you're comfortable and if it's possible. So thank you again. And I would now request Miss Beth to take over. Over to you, Beth. Can you hear me?
Yes, thank you, Kavita, and good afternoon, everyone. It's a pleasure to be here with you today, and I'm really excited to see such interest and such a high turnout of people to join our session today. Um, we can go ahead, I think, s- we can actually go to, there we go. I just have a few slides and then a video that I'm going to show you to kind of kick us off and get us thinking about the topic for today. So just to start a little bit with thinking about context, and I know that you're all professionals working in the field of child protection, so it won't go into a high amount of detail. But just to say, disability is a really complex issue. It can be understood differently and described differently depending on the cultural context. But in terms of definition coming from global frameworks, it can be defined that persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. So important to understand that it's a complex relationship between the mind, the body, and also the environment in which children live. Today, we're focused on children and children's lives. And also, most importantly, is to realize and consider each person and each child as an individual. However, if we do take a look at the numbers in terms of the prevalence around the world, according to the World Health Organization, 15% of people in the world have a disability. This is an average across many different countries, but this would translate and mean that in India, more than one in every 10 people probably has a disability. 5% of the world's children um, have a disability, but we also know that identification and measuring disability in children is not always easy. Um, Many children who have disabilities or developmental delays will be living hidden lives and may not be identified. If Given that we know that poverty is a major factor in children being separated from families in India and placed in alternative care, particularly in child care institutions or CCIs, the final figure that you see on the screen is also critical. 20% of the world's population who live on less than $1.25 per day have a disability. Most children in institutions have families and have been placed in institutions due to poverty and or disability and the stigma associated with disability. And in our own work to improve the lives for children and ensure that families are strong for all children, we simply can't ignore the role that disability plays. And that's why today's conversation is so important. We could go to the next slide, please. But today we're also going to zoom in on the topic of transition of care services. I just want to set the stage by explaining that this term really means helping families to raise thriving children, reintegrating children who are in alternative care, especially child care institutions, back to families, but also helping those CCIs to transform to community-based and family supportive services. Children with disabilities are first and foremost children. All the provisions in the United Nations Convention on the Rights of the Child apply to them. Amongst all the rights listed, including family environments, um, are applicable. But there are also specific articles. For example, Article 23 says that children with disabilities have a right to live full and decent lives with dignity, with independence, and to play an active part in their community, and that the state must do all it can to support children with disabilities and their families. Children with disabilities are often left behind when we start working on childcare reforms. And unless family support is guaranteed and protected, children with disabilities are at risk of remaining in CCIs or being further segregated as those CCIs transform. People like all of us who work with children and families and in communities often don't have the information, training, or comfort working with disability that we need to really incorporate inclusion into our transition work. We could move to the next slide, and I just want to, we're going to watch a short video, but before we start that, I also just want to make sure that we all understand this term disability inclusion. It's not about creating something different. It's about making our current systems inclusive. Inclusion is a process of systemic reform that embodies changes and modifications in legislation and in policy, in service provision, and to social norms to really overcome barriers with a vision to serving all children with equitable experiences, which correspond to their own individual requirements and preferences. But let's hear directly from the people who made this video just about the impact and this interface with poverty before we go to our next speaker. We could cue the video, please.
Yes, I'm just doing that.
Kavita, if it isn't working, that's okay. We can just continue on.
Is my screen visible?
Yes, your screen is visible. We can see the video now.
Okay,
Let's see if the sound is working, and if not, we'll just move on to the.
My name is Khalid.
Great.
Is it coming?
Yes. Yes.
My
thank
name is
you.
Alexander.
My name is Abid.
My name is Obada.
My name is Maji.
هذا
My name is Renee.
لورينزو.
My name is Blas.
My name is Ekaite Judith Umo. I am one of the 1 billion people with disability in the world right now.
I have the right to lead a full life with equal opportunities.
And live free from discrimination and exclusion.
But
Having a disability means I'm more likely to live in poverty.
I was left out of school.
I have been left out of employment.
I did not receive the health care and rehabilitation I need.
People think I should not have a family and children.
And
Because I live in poverty, I am more likely to obtain a disability.
I didn't have the opportunity to eat nutritious food.
I had an accident, and my family couldn't afford the treatment.
I was injured in the war and I couldn't access treatment.
I had no access to immunizations or the health care I needed.
So, because I have a disability, I'm more likely to live in poverty.
And because I live in poverty, I'm more likely to have a disability.
It's a persistent, unfair cycle that I and millions of other people are trapped in.
But the cycle of poverty and disability can be broken. If I have the opportunity to contribute to my family and community,
without discrimination and regardless of gender.
And if all children with disability have the opportunity to go to school,
and teachers have the training and skills to include all people, then we have the opportunity to end the cycle.
If I am given the chance to work and generate income for my family,
And if I can access the physical and mental health care I need,
then we can end this cycle
of poverty and disability.
I have human rights the same as everyone.
I have the right to defend my interests.
I have the right to be independent in my self-determination.
I have contributions to make.
Imagine how much richer every community will be.
When my skills and talents are contributed, let's end the cycle.
Let's end the cycle.
Let's end the cycle.
Let's end the cycle.
Thank you, Kavita. I think that is such an important and also hopeful video. And when we think about this idea of end the cycle, today we're really talking about ending the cycle of children with disabilities, ending up in institutional care, supporting them in families and communities, and making sure that they have the same rights as all other children. And with that, I'm going to turn over to our next speaker. Radhika has already been introduced. Just to say a little bit more, she's the founder and managing trustee of ASTHA. I'm sure I'm probably not pronouncing it correctly, a community-based non-governmental organization that works with children and disabilities and their families. And she's been doing this for the last 30 years, has a lot of experience to share with us. Radhika, over to you.
Thank you. Thank you very much. Namaskar. Can you hear me?
Yes, ma'am, we can hear you.
Okay. Thank you very much. Namaskar. It's very nice to be with everybody today. I'm going to just talk a little bit about, you know, since I started working in the field of disability and till today, there has been a huge change in thinking, in my own thinking, from the day I started and today. And I want to take you through that change in thinking because it is the way we think about people that affects the kind of decisions we take for them and the kind of care plans that we have for children with disabilities. And we are talking about children with disabilities here today. So when I started my work over 30 years ago, there was a thinking, and I think even in myself, you know, we were do-gooders. We thought that what we were doing was very good starting an organization, but somewhere behind our minds was a charity perspective. It was a perspective saying that, you know, whatever I do for this child, it's all right. I was a kind of do-gooder. The relationship was between a more powerful person, that is the person who's providing the services, and the person who's receiving, that is the child and their families. In this kind of thinking, there's no really need to think about the rights of the child. And at that time, we did not think about the rights of the child. We thought we were providing services and good services, but probably there was charity behind our thinking. Next, please. And then, over the years, there has been another kind of perspective, which is called the medical perspective or the medical model of disability. And this perspective, and I must say that this perspective is very much reigns today also, even though our thinking has changed and there is the UN Convention, but we hope past there is a lot of the medical model that we think about. In this model, what happens is really the impairment of the child takes over. So our whole focus is this child cannot move, cannot see. We divide up children. We call children, do a line between children and say, here are all the normal children. Yeah. We forget that there is a great diversity here. And here is this child with disability who is abnormal. We talk about children who are educable within children with disabilities. And we've also say children who are not educover. We kind of divide up children medically into mild, moderate, severe, and profoundly disabled, where the profoundly disabled child is supposed to be able to do absolutely nothing. And all this thinking is based very much on the medical condition of the child. It's not based on anything else. So our whole focus then becomes medical rehabilitation. We have to take the child to the hospital. As you know, that first, right in the beginning, parents do take their children to the hospital. Doctors are extremely important. They do diagnose and tell the family perhaps what the condition of the child is. But that is not the only thing that is important in the rehabilitation or the habilitation of the child. And very often families get involved, and those of us who make care plans for the child, we get totally focused on this aspect of the child. And we do not think of the other aspects of this child. There is a thinking in this medical model that children with disabilities lack capacity. So we are always thinking of what is wrong with the child. We are not thinking of what is right with the child. Very often you will hear things like, oh, this child cannot come to school. So the focus is on the child not coming to school, not the school not being open enough for the child. So the whole idea is the child does not have the capacity to come to school. We think about, this is also, we think about separate facilities, specialized personnel. Now, I'm not saying that specialized personnel are not important in the habilitation and rehabilitation process or when we make care plans for children with disabilities. But they're not the only things that we need. But when we focus only on that, and that is why perhaps many of us feel, for example, that we do not know what to do with this child. I hear this again and again from my colleagues in different spheres. We're not able to do anything, not able to include the child because we don't know what to do with the child. Maybe behind this is a kind of thinking that this child requires too much specialized work, specialized inputs, and therefore we do not know what to do. She would be better off in a separate facility. This kind of thinking has led to a lot of institutionalization of children and people with disabilities across the world. And as we know that this institutionalization has often been seen as the way out for the child with disabilities, in a way, put them away from society. And many of these institutions have been and are continue to be closed-door institutions where there is very little interaction that the child has with the outside society and the world. And this often leads to a lot of violence, exploitation, abuse. In this model, we often have not thought about concepts such as the dignity of the child. So when you only see a child as a medical entity, you forget that she needs her privacy. We often talk about the child in front of the child. We don't focus on the participation. How will she participate in all the activities? We don't have to ask these questions because it's easier to put the child away. How will we help her become more independent, develop her abilities? And how will she be included in all the activities that everybody else and all other children are participating in? Next. Oh, in the last 30 years also, there has been big movements of people with disabilities across the world. And these movements have challenged this kind of thinking. Since the 1980s to 2006, where we got the UN Convention on the Rights of Persons with Disabilities, an extremely important, can you hear me better now? Somebody saying my voice is not clear?
It is quite clear on my side. I can hear you fine.
Yeah.
So the UN Convention on the Rights of Persons with Disabilities came about in 2006. And it's a very unique convention because people with disabilities were at the center of this convention in the negotiations. And the slogan of nothing about us without us was prominent during the discussions of this, the UNCRPD. And for the first time, you know, in the disability field, we used to all be very separate. People working with different impairment groups or people from different impairment groups, people were always separate. But for the first time, we had people coming together, looking at all the challenges and looking at all the things that happen to all people with disabilities. And that is how we have the UN Convention. It is a paradigm shift in our thinking about disability rights. And the crux of this paradigm shift, in a way, as Beth already told us, is the way we have thought about what disability is. So earlier we would think disability is lack of a limb or can't see. Those are the ways in which we defined disability. But today, the UN Convention defines disability as persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. Now, this way of looking at children and people with disabilities totally changes the way we work, the way we think, and the care plans that we make for children with disability in whatever setting that we are working in. Next. I think there's one more, yeah. Is this the next one, Kavita? Yeah, yeah. So what does this, really this definition, in a way, it's not really a definition, it's a way of looking at and understanding disability. It tells us many, many things. Finally, suddenly we start thinking that children with disabilities are part of all the social structures of a society. There are girls, there are boys, they belong to different religion, classes, ethnicities, other vulnerabilities, street children, all divisions that we have in society. So we cannot make care plans without considering this. For example, if there's a girl and a girl child with disability, then there is a double marginalization that we know of and we understand, and our care plans have to reflect that. It also tells us, because it talks about barriers, barriers that can prevent full participation. Contexts become important. Where is this child? Where does she live? Is she in the desert? Is she living in a forest? Is she living in an urban slum? Is she in the remote tribal community? All these things matter when we make care plans for the child. What are the barriers that are confronting her family? So earlier, we never thought so much about the family. We just thought that the child should be made to be different. She should be catching up with other children all the time. But the context become extremely important. The family, what are the barriers? Is it a very poor family? Is there someone else who's very, very unwell, who has a long-term illness in the family? Are there two children with disabilities in the family? Very often we see grandparent-led families when we talk about children with disabilities. In our work, a lot of grandparents are very, very important, and they take a lot of responsibility for the child with disabilities. And so when we make care plans, we have to consider all of this. What is the community like? Does it really accept this child? Can the child go out? Does she have friends? Is she able to go out to gatherings and things like that? These become very important. And as we all know, there is a very strong link between disability and poverty. It's a vicious circle. And it's a vicious cycle. And if there is poverty, then you have to deal with poverty also. You cannot just deal with the condition. The other thing is that we also then look at all the institutions of society, like education, health services, protection services. Do they include this child? Are they designed in a way that they give equal participation to the child? Now, that, as you know, is a big question, and that is really the struggle. So it is important that children and people with disabilities are included in all these institutions. Next. Article 3 of the convention has is really the building blocks of what we call the paradigm shift. And these building blocks are non-discrimination, full and effective participation, and inclusion in society, equality of opportunity, respect for inherent dignity, individual autonomy, the freedom to make one's own choices, and the independence of persons, respect for difference of persons with disabilities as part of human diversity, the difference between men and women. And then it also talks about the evolving capacities of children with disabilities and their right to preserve their identities. I will talk a little bit more about this later. Next. So the UN Convention is also against institutionalization. And because there was a lot of discussion at that point when the convention was being made, the reality of people with children with disability, people with disability and their lives was institutionalization, is very often institutionalization. So there was a lot of discussion here. And so there is Article 7, and it talks about children and people with disabilities, children with disability enjoying all their human rights, the right to express their views. We never think of asking the child with disability what she wants or supporting her to say what she wants to do on an equal basis with other children, and to be provided disability and age-appropriate assistance, because sometimes children with disabilities will require support to be able to communicate what they want to say. The Article 19 is a very important one in the convention. It talks about the right to live independently within the community. Now, this is very important when we're talking about reintegration, but it talks about it. There are many caveats there, and it gives you a great amount of detail of what we should be doing so that the child can live in the community with dignity. We have to be able to provide the supports to the child there, assistive devices, adaptations, whatever is required for her to live independently in the community is extremely important and is to be provided. It also talks about the right to choose where you live. This again was part of the discussions and very much against institutionalization, which was seen as almost a default for children with disabilities. Right to home and family life, Article 23, the right to be part of a family, the right to marry to retain fertility. Very often earlier, it has been thought that children, as they grow older, people with disabilities should not marry. They do not, very often girls with disabilities, hysterectomies are done, and the thinking was that there is no need for them to have children. We just need to safeguard them from any violence and abuse. These are practices that still happen today. Next. So children with disabilities have an equal right to family life. This also stresses the importance of early support services and information, because information is just not available to prevent concealment, abandonment, neglect, and segregation. If you go to a community and walk into a community today and ask, is there a child with disability? You will probably get an answer saying, yahan to koi nahi, there is nobody here. But when you actually sit and you talk and you start your work, you will find there are many children with disabilities who are actually still hidden in our country. If families are unable to take care of the child, every effort to provide alternative care, and this is the alternative care network in our country that I'm talking with today, alternative care within a wider family, community in a family setting. Children are not to be separated from their families unless competent authorities feel that it is in the best interest of the child. Now, this is a very tricky one, because very often when competent authorities feel that the child should actually be separated, and we have to look at what kinds of decision our competent authorities in this, our CWCs and all, actually take for the child with disabilities. It would be important to study this. Next. I think we missed one slide, so I'm going to just say that in a situation like this, when we talk about children with disabilities have all the human rights as other children do, when we make care plans for children with disabilities, those care plans don't only look at the medical condition of the child. They look at who she is, what kind of a personality is she, what are her interests, who is her friend, how do we provide supports to her, does she need any assistive devices, how can she be part of all the games and participate in all the activities that are happening. Those are the things that become extremely important when we make care plans, even when we are talking about reintegration, because this is the basis of inclusion into a society. And we work on those things so that there is a difference in the care plans we make when we think medically about a child with disabilities, and there is a difference in the care plans we make when we think of the child with disabilities having all the human rights. Now, in India, there was a lot of discussion. India was one of the first few countries to ratify the UNCRPD. And there was a lot of discussion, and the 2016 Rights of Persons with Disabilities Act came after huge movements in the disability sector, historic movements, which hopefully you will learn about at a later date. We all came together, cross-disability thinking happened, people with disabilities got together, and there was a lot of advocacy that happened, and we got the 2016 Act. Very much, it echoes the UNCRPD in many ways. In the definition that we just talked about, it widens the scope of the conditions. So from earlier, we had 7 conditions we recognized as disabilities. Today, we have 21 conditions that we recognize. Also, many of these conditions are conditions where a child is born with a disability. Recognition of things like reasonable accommodation, I'll talk about it a little bit more. Prohibiting discrimination on the grounds of disability. As you know, a lot of discrimination happens because the child is disabled. She can't go to school. She can't come here because she is disabled, because she can't talk, because she can't communicate. She cannot be part of all the activities with other children. There was a wider understanding of communications and accessibility. Children with disabilities do communicate differently, and accessibility, which is normally seen as a very narrow concept, was widened in the CRPD as well as in our Rights of 2016 Act. New terms. So we have terms such as benchmark disabilities. We have terms such as persons with high support needs. Now, earlier, if you remember, I talked about children being seen as severely disabled and profoundly disabled. That was based on a very medical thinking of disability. But today we talk about a child with high support needs. So this is a child who may need higher supports, and these supports could be many different kinds of supports. So the whole concepts have changed. Then the caregiver, recognition of the caregiver as an important part is also there. Universal design, designing our services in a way that they suit all children including the child with disabilities. This is what universal design is all about. That doesn't mean that we don't have separate services and we don't provide assistive devices to children with disabilities. But the idea is that we design services in a way that all children can be included. And that is a concept that the disability discourse has given to the world. And there is a twin track approach. When you need it, you can have separate services for children with disabilities, but largely this law and the UN Convention are talking about inclusion and the right to inclusion of the child in all services for children and in the development of a country. Next. The Section 4 of the RPWD Act talks about women and children with disabilities enjoying their rights equally with others, and it's a cross-cutting right. Yeah, all children have the right to express their views. Once again, we are talking about involving the child in making care plans, in really asking her, discussing with her what the care plan should be, in as much as we do that with all other children, and giving her the supports. Next. The RPWD Act also talks about the right to live in the community with support services, including personal assistance to support living. Yeah, so personal assistance, sometimes you need another person to support the child. And that is not an option. It's actually a right. The right not to be separated from the families, just like in the UNCRPD, not to be subject to any medical procedures, yeah, leading to infertility. As you know, this is a big issue as far as children with disabilities are concerned. To be protected from abuse, violence, exploitation, cruel and inhuman treatment, and in case this happens. There is a history to this. I'll talk about it a little bit more later. Equal protection in situations of risks, armed conflict, humanitarian emergencies, and natural disasters. We've just gone through the COVID-19 disaster, and children and people with disabilities, we did find were very vulnerable in this disaster. These are some of the reasons why children also get institutionalized. Next. For the first time, we have a definition of inclusive education. Earlier, we used to only talk about inclusive education. Now we have a definition in the law, and we have sections on social security, on health, rehabilitation, and the right to recreation for the child with disabilities. So you can see there's a much wider range of rights than we had earlier, and they encompass nearly all the human rights that all children have. So we're talking about facilities for children who have no family, who have been abandoned, without shelter, free healthcare, barrier-free access to health facilities, priority in attendance and treatment, and screening every year, access to rehabilitation services. And the big change is that, you know, all the ministries, till now, it is even now the Ministry of Social Justice and Empowerment, which is the nodal ministry in our country that looks after disability. The disability sector has long advocated that it should have been the Women and Child Ministry. But today, all the ministries are implicated and are duty bearers in the law, with the ministry being the nodal ministry. And we see today now more and more other ministries which earlier did not talk about the child with disabilities, beginning to take some responsibility for this child. More particularly, we see that in education, and now we are beginning to see it in the Ministry of Women and Child also. And that is what really fuels inclusion. Next. But what I'd like to also point out to you that there is, you know, once you sign a UN convention, all your laws have to be in tandem with that convention. But our disability laws themselves have not changed. We have a new law, the Rights of Persons with Disabilities Act, We have a Mental Health Care Act of 2017. Both have been harmonized with the CRPD. But we also have the National Trust Act for the Welfare of Persons with Autism, Cerebral Palsy, Mental Retardation, and Multiple Disabilities. We have the Rehabilitation Council of India Act, which deals with all the personnel that have to be there for disability. And these laws have not been harmonized, and that's a big, big issue with the UNCRP. So they don't talk in the same language. And it's the same thing is true for all the child care laws. For example, the JJ Act, and I know that many of us on this call today work with the JJ Act or the RTE Act. We were part of the framing of the RTE Act at one point. Very happy that it included children with disabilities. But with the new changes and with the Rights of Persons with Disabilities Act, we find that all these laws, the POCSO Act, although they mention children with disabilities, but you have to sit and look, the thinking on children with disabilities remains very medical. So those of us who work with these laws and their rules and the, all the guidelines on foster care and adoption, we really need to sit down and look at them in relation to the new terms and concepts. So if the new terms and concepts that are there in the disability law are not part of these laws, or the thinking is different, then it's unlikely that we are going to have care plans that really see the child as a child and not as a medical entity. Next. When the COVID-19 pandemic happened, as you know, world over, there was a realization that children and people with disabilities in institutions were not protected, and were also in very, very difficult circumstances. News after news came of this world over. Because these were closed door institutions, there was no knowing, there was no connection with the outside world. And therefore, once a person got COVID, many others got COVID, including the caregivers. The UNCRPD committee then comes up with guidelines on deinstitutionalizations, including in emergencies. And these guidelines, which I do hope you will read, recognize institutionalization as a form of violence against persons with disabilities. It talks about ending new placements in institutions and refraining from investing in institutionalization. For children, we cannot, very often we say, no, it'll be better, she'll be better there, she'll be protected. Very often families also feel, my be looked after better if she's an institution. She'll get food, she'll get educated. But institutionalization cannot be seen as a form of protection for the child with disabilities. So the core of the right to be included in the community is the right to grow in a family. In an institution cannot be a part of that right. It is important that we look, and now we look carefully at alternative care, we look at adoption, foster care, sponsorship. And it's important to look and to see how and whether they are actually including the child with disabilities. I don't think there's been too much research on this. I would urge that we do some research, that we look at these schemes, we look at these guidelines very carefully and see how they are actually being practiced in the country. Next. Some things to be done: prioritize the development of a range of high quality and individualized support. Children will require support. Inclusive mainstream services in the community. We have to see, if we don't provide services in the community, how will she live in the community? Yeah. Support services are very important. Personal assistance, peer support, caregivers in a family setting, supports, crisis support, support for communication, for mobility, for the provision of assisted devices. All these and other community-based services are extremely important. So the law does talk about it, but we do need to interrogate and see, actually in our country, do we have services in the community? Are there support services that are available? My understanding is that they are very scant, and And that is a difficulty when we are talking about reintegration and other things. Support should be provided so children can use mainstream services such as education, employment, and the justice system and the healthcare. Yeah, next. So, Kavita, should I go on to the concepts important for child protection?
Yes, ma'am, we can go on. Yeah.
Okay. So I'll just briefly go into some of these concepts that we talked about earlier. Acknowledgement and respect of diversity. So diversity is a very, very powerful concept. It is a concept that we need today in all over the world, where we are actually narrowing ourselves. We are, and we are wanting to become one identity everywhere, all over the world. In this, the disability discourse reminds us that world is full of diversity, and disability is just part of that diversity. So rather than looking at children as up and down, as better and not good, or not better, as normal and as abnormal, that rather than these dividing lines, let's look at diversity like stars in a sky. Everybody is there. And that respect is what we need to think about. And that's a profound change in our thinking. Equality and non-discrimination. Now, equality does not mean that we have the same for everybody. For a child with disabilities, she may need what we call reasonable accommodation, small changes. For example, if a child finds it, her hands, it's difficult for her to write with the same pencil that all the other children are using, but she can write that with the pencil which has got a grip to it, a bigger grip to it. And that's a small change we are making so that she can also do the same things. Yeah. So what we call these small changes, reasonable accommodation, don't require a lot of money, but they have to be factored into our budgets, and they have to be factored into our care plans for children. Otherwise, you will have a classroom with the same chairs for every child as we have in every classroom in our country. But this child may not be able to sit on that chair. So you do equality means that you provide what is necessary for that child to be equal. You do not discriminate. Discrimination comes in many forms. You can have direct discrimination. No, she can't come to our school. The other thing is, oh yeah, of course we'll take her after the RTE Act we hear. Of course she can come to the school. But who will look after her? Yeah. Then the third thing is, yes, of course, she, it's better that she's not in school because, other children, they will bully her. So it's not good for her to be in a school with other children. Better to put her in a school or keep her at home, where she will not be bullied. So that is discrimination in its various forms: direct discrimination, indirect discrimination, sometimes in a way that it's almost we are doing it for the good of the child. And therefore, it's very important for us to interrogate when we say a child should be separated or put away in a room, whether we are doing it really for the good of the child or whether we just don't know what to do with her. Equality before law and the evolving capacities of children. So, people with disabilities, with a focus on people with intellectual and psychosocial disabilities, for years all over the world, have not been seen as having the capacity to make decisions for their life. You and I, we will decide when we want to marry. After we are 18, we are free agents. Yeah, we can decide to leave a job, but not these people. There is this concept of unsound mind, which you will see in many, many of our papers and laws and things like that. And people with disabilities, particularly these disabilities, were part of this, what is called unsound mind. And this meant that you made substituted decision-making. We made decisions. There was guardianship. for people with disabilities. Children, as they grew older, were not free to make their own, but they had to have guardians. So guardianship was very much there. And substituted, we made decisions for them. But today, we are talking about supported decision making, supporting a child and a person to make their decision, not making the decisions for themselves. This is the fulcrum of the big paradigm change. It is really talking about of the UN Convention, Article 12, if you look at it. It talks about supported decision making and equality under the law. Now, that's a very big change that we have, and it is still in the making in our country and in many other countries, but it is where we have to aim to and reach towards. And that is why the convention, the principles of the convention talk about the evolving capacity of children with disabilities. Because very often we've given up on the child when she's a child. Nothing going to happen to her. She's not going to change. She's not going to develop. So why invest in this child? That has been our reasoning. And therefore, the convention talks about the evolving capacity. We have to remember that just like for any other child, this child is evolving at her own pace. And that is what is extremely important. The right to have her own identity, to be protected. Very often birth registration is denied to children with disabilities. Early childhood services such as immunization, the right to a name, all these things you will see that are often denied to the child with disabilities. And then the identities that we have as we are born, these get compromised. And that is why it is so important that we look right from when she's a child, that she's having all the protections that any other child has to become later a citizen of this country. Inclusion and full participation. Inclusion is a word that I sometimes feel a little irritated with now. I'm sorry to say this, but sometimes I feel it's a little, it is a right of the child to be part of everything. And we have to change the way our services are structured and designed so that she is an equal part of this. So it is really her right. It's not including her in what we have already, because that's not inclusion. You bring a child to a school and have all the chairs together. You take her to the playground and everybody's running around playing Kho-Kho, but she can't participate in that. You have to change the game. Change it so that she can participate. That is inclusion. Look at your, very often we find that in the rules and regulations we have in institutions, those are the places where we stop inclusion. And full participation. Full participation is really participation according to me, where I am going. In order to participate fully, I don't have to be like other children. I don't have to play the game in the same way that the others do it. But my full participation may mean lying in a circle with everybody around me and participating in the game. It doesn't have to be that I'm pushing the ball like everybody else is. For me, that means full participation. So we have to find the ways where children participate fully. Why is this important for child protection services? Because when we don't do that, we have a real problem, and we can go into the realms of neglect and abuse and violence. A wider understanding of accessibility. Accessibility is not only in physical buildings. Accessibility is about accessibility in services, in outdoors, in information and communication, in the information and communication technology. It's a much wider concept than we've thought about. So in our services, we have to have accessible services. Communication. One of the biggest barriers in front of children with disabilities for full participation is some of them. In Astha, if I say at least 30% of the kids we work with, 30, don't speak in the same way or don't communicate in the same way as I do. But does that mean she doesn't communicate? No. She communicates in very different ways. It could be sign language, it could be through her eyes, it could be through her body, it could be through plain language, and so many different ways that she can communicate in. And these are the things that we have to recognize, because very often when a child doesn't communicate in the same way, we feel she doesn't communicate and so she doesn't think correctly, or she is a child with intellectual disability. So these are some of the pitfalls that we should not follow. Yeah, next. Issues of violence, abuse, and exploitation. Unfortunately, there has been a thinking that what is not okay for all children is sometimes okay for children with disability. I can tie her up. I can tie her up and let her be for long periods of time. It's okay. But the question really is that correct for the child? Sometimes she may need to be tied for a little period to give her stability in sitting. But that does not mean she should be tied up for the whole day. And what does that take me into the realm of violence, abuse, exploitation? Sometimes we come up with very difficult situations. A family needs to go to work. They lock the child in. They lock the child with disability in. So what does that mean? Is that neglect? Is that exploitation? Is that abuse? There has been a huge history of aversives used for children when we talk about behavior modification. You know, like sometimes children are running around, or sometimes children, when they communicate differently, for example, they may hit out at another child, and they may communicate in ways that are not acceptable to us. But and so in order to deal with that, there is a whole, whole area of behavior modification and the use of aversives, shutting up a child in a different room, not giving her food to eat till she sits down, giving her drugs, I have seen with my own eyes in an institution, children and people with disabilities with being given at least 5 psychotropic drugs in one go. So many, many things that have happened, that are often seen, sometimes even as rehabilitation strategies. So it's very important that there is a definition of what is violence, abuse, exploitation, neglect, and concealment of children with disabilities. This can happen in any, in a school also. Importance of the family, acknowledgement in the family is the most important for any child, and for this child also. It's extremely important to support the family. Very often families do break up. Sometimes, very often, it is the mother who is really strong and she can be supported. And I have seen so many mothers and fathers, but more mothers, become very, very strong individuals. And not only do they work with their own child, but with other children with disability, become strong advocates. And those are strategies that we must use. We must also understand that children with disabilities and their families, there are disability-related expenses. Families will need to go again and again to, rehabilitation facilities, to the hospital. They may need medication. They may need assistive devices. These expenses have to be taken care of by any institution that is looking after children with disabilities. The importance of information and support. There is very little information and support available in our society openly. So that is why we find very often families running from pillar to post, trying to understand what has happened to my child, trying to look for services that will help her develop her abilities. And these things, when you spend a lot of time doing that, it compromises the growth of the child. And finally, we must acknowledge the mental health fallout of exclusion. I have been documenting the work of 5 community-based organizations during COVID that worked with children and people with disabilities. And the mental health fallout of exclusion is huge. So in our care plans, we have to factor in all these things. Next, I think that's it.
Yes, ma'am, that's the.
So basically, that's what I have to say. Thank you very much.
Thank you so much, Radhika ma'am. That was really, really informative, and I hope everyone must have the same feeling. I would request Beth to take over. Now we'll be discussing about inclusion in transition of care services. Beth, am I audible to you?
Yes, thank you.
Yeah.
Thank you, Kavita, and thank you, Radhika, for giving us that really important and in-depth background. We also see some great comments coming in the chat. Please, this is to participants, please do engage with the conversation by using the chat to note your questions, your comments, tell us about the work that you do. It's always very challenging online to make sure that we have our webinar participants really engaging in the conversation. So let's use the chat to do that as we move into this next part of our conversation. We can go to the next slide, please. I'm going to take us back to the topic that we're really looking at today. Please keep in mind all of that information and background and an important context that Radhika has provided us with. I said at the beginning when we talk about this idea of transition of care services, is really about changing the model of services provided by an organization. And by an organization, I mean that organization which operates the residential care service for children. Transition is really about shifting to a focus on non-residential services, a focus on caring for children in families and caring for families. And when we talk about disability inclusion, this is really complicated. There's a lot of different factors that go into it. And as Radhika described, often we have very strong legislation, very well-written policies. Maybe there's a few missing pieces, but really the work that we do at the community level is about translating those policies and really making sure that they're being implemented. So transition involves change at all levels of the organization, and it includes, but it's not limited to, the safe reintegration of children. I think Radhika made such important points about this word inclusion and what it really means. We, in the work that we do, we need to be pulling apart all of these terms and really digging in to what they mean for our work. So just another reminder, disability inclusion is not necessarily about creating something different. It's about making sure that the systems that exist are inclusive, making sure that our current efforts in India on childcare reform, and there are a lot of efforts, I'm sure I don't need to tell you that, there's a lot of work going on, making sure that those reforms are considering and really working to include all children. If we consider care reform as a disability inclusive process, we have to look at the legislation and policies that Radhika mentioned. Are all children and families considered there? When we look at service provision, do families have what they need in the communities? Are those services accessible to them? And then I think really important to mention this, this idea of really working to change social norms and overcome the barriers that are that we face in making sure that all children have equitable experiences, and social norms are a big part of that. I'm going to continue to put some questions in the chat that I hope that you will take a minute to think about and to respond to. Again, this is the way that you can engage. with our presentation today. We also do want you to begin putting in some of your questions. We will have time for question and answer. But right now, I want to get a little bit more specific in terms of the work that we can do to really make sure that that transition of care services is inclusive. And that really begins with understanding the children and their families who we're working with. If you're part of perhaps operating a CCI or of helping a CCI to do some new kinds of services, we need to understand who the children are in care, as well as who the children are in the community. We need to look at how to make our case management services, our case management tools, much more disability inclusive. Do we have questions or topic areas in case planning, which Radhika has mentioned many times, that look at disability, that look at child functioning? Are there questions about what kinds of adaptive equipment that child might need, whether or not there's something about education that we can do to make education more accessible to the child. And very specifically, also looking at families. When we do an assessment of a family, are we looking at how accessible their home is? Are we looking at what issues in their community around stigma they face, and how we can set case goals around some of these things? If we talk about family strengthening, an important part of reintegrating children is making sure that families can provide safe and nurturing care. Are there going to be issues of childcare? Radhika mentioned sometimes children being locked up simply so that families can go to work and bring income that they need to support their family. Part of family strengthening is ensuring access to some kinds of day services so that families can go to work, but also so that children can thrive and be a part of the community, perhaps part of education. I think one of the most important things that I've seen around the world is the development of inclusive education. Systems, programs, services, very specific supports for children so that they can be part of going to school. And if we can get children into school, they're often less likely to be institutionalized. They're less likely to be segregated in their communities. Parents can go to work when children are at school, but this takes a lot of effort. And this is one area that we can be advocating for and working towards. I want to mention just a couple of really important services, very specific services. These are often, I've seen CCIs in other countries, and I'm sure there are some examples in India as well, of residential services that have transformed into services that really support young people with disabilities to live independently in the community, or services that provide very short-term, what we would call respite care, so that families can get a break, and other support services that will help children with disabilities to be part of the community, to be part of those games and activities that Radhika was mentioning. So all really important kinds of services. It's not easy work. It definitely requires seeing what the gaps are in our communities. Earlier, I put a question in the chat to ask what service gaps you see in your own communities. This is not work that can be done by one organization, but these are some of the very specific kinds of things that we need to look at when we're talking about moving away from CCIs and from residential care towards care for children and families. Let's go to the next slide and talk about just a few more things before we also are going to go to a really important panel discussion and onto some of your questions, which I hope you're beginning to fill in the chat. Please also notice that we've put some resource links in the chat for you to take a look at. Additional important points when it comes to transitioning away from residential care. We've mentioned a lot addressing the stigma and discrimination in the communities, raising awareness, bringing disability visibility in a community. It doesn't necessarily need to have a strong investment. Sometimes addressing stigma, bringing awareness can be simple and not resource intensive, but it's critically important that we make sure children are having that, that the community, is having an opportunity to really have interactions with all different people, all different children, and to talk about the value that all children and adults with disabilities bring. We need to help if we are supporting CCIs to transition to become different kinds of community services. Then we also need to help them really understand disability. We can't just ignore it. It's very, very likely that any CCI we're working with does have children with disabilities. Remember to earlier in our conversation today, the prevalence is high. If we think about at least 1 in 10 people in a population having a disability, then it's very unlikely that any CCI would have no children with disabilities. I think this next point is really important. There are organizations in India, organizations that are of people with disabilities who really know this work, who are working hard on addressing stigma, who are very good at providing the services that are needed. We don't need to reinvent. We don't need to become necessarily a specialized organization. Partnering with organizations of people with disabilities, like the organization that Radhika works with, can be a great way to further this work. We've already mentioned really understanding the service gaps. I have seen in some countries where a CCI will maybe begin to transform to a different service, but it turns out that service wasn't needed in the community where they're located. So we really need to understand what are the service gaps, both where the children are coming from and where the families are, but also where our facility is located, and matching up those services that we're going to provide with the needs that are in the community. Disability and really child protection in general is multi-sectoral. It is about accessibility to lots of different kinds of services, to education, to health services, to social services, sometimes to rehabilitation, to justice services. So we have to also be thinking about these, the interaction between these different sectors. And then the final point I think I want to make before we move to the panel is, I think sometimes all of this information can be really overwhelming. We really don't know where to start. There's a lot of work to be done. And one of the best things that we can all do as individuals is to continue to learn, to continue to step into our own communities with our eyes open and pay attention, to have conversations, to learn how to communicate in ways that we're really learning about disability and about people with disabilities in our own communities. And then to really lead by example, again, by stepping into the conversation, by raising awareness. There are many simple and cost-effective things that we can do. And I just want to really underline that you work to not get overwhelmed by the issues, and just again, step into the conversation and continue to learn as you do the work that you do. I want to switch now. I'm sure that you've heard enough of my voice. I want to really move us into a more interactive conversation by welcoming several guests to open their video and to join us for a panel discussion. Please continue to put your questions into the chat. We will bring those into the conversation as well. But first, let me welcome back Radhika, if you can open your video. And I'm going to just remind people that Radhika is the founder of a community-based organization that works directly with children with disabilities and their families. She's also a researcher and has published many reports on the status of children with disabilities in India and the implementation of laws and policies. I'm also now going to welcome another guest, Seema Chadha. Seema is if you can put your video on, Seema, I hope you're there with us. Seema is a registered developmental therapist and counselor. She's the deputy director of an organization called Muskan. I hope I'm pronouncing that correctly, where amongst many things, she's played a pioneering role in designing, launching, and scaling disability-focused programs, particularly assisted living, independent living training, and inclusive education. I think it's so important that we see the resources that are that exist in India. We have permission to also share that Seema is a parent of a 32-year-old daughter who does have multiple challenges. So she's bringing really a wide perspective. And then finally, welcome to our third panelist, Nipun Malhotra, who is the co-founder of the Nippon Foundation, working in health and advocacy for persons with disabilities, as well as being the director of programs at the Quantum Hub and the Youth Leaders for Active Citizenship. Just an amazing background as I was reading it this morning here in the United States at my time. His accolades include working on key initiatives such as advocating for disability rights at the global stage, connecting people very directly with wheelchairs and other accessibility, and doing audits of public spaces. So welcome to all of you. It's a little hard for me to manage seeing my screen. There you are, I see you now. Really, really warm welcome. I'm looking forward to this conversation. I'm going to start with a question for you, Radhika, and just to make sure we have enough time for all of our panelists today, I'd just ask you to keep your responses fairly brief. We want to take some participant questions as well. Radhika, in your child protection work, what's one of the biggest challenges, just one of the biggest challenges that you face related to disability inclusion?
I think it's lack of knowledge.
Mm-hmm.
One of the biggest challenges is lack of knowledge all around, publicly available knowledge on how to support the child with disabilities.
And maybe just a follow-up to that, when you say lack of, who is it that's lacking that knowledge? General public?
It's general public, and it's also not available for families. When families need that knowledge of what to do, where should I go, those things are not available. So there's a lot of time that is spent that gets wasted actually in trying to understand. And very often that doesn't happen at all. So that, just supports so that the family and the child know where to go and what to do. So that is, to me, is one of the biggest issues in child protection.
Yeah. So important to have that knowledge to begin with. And actually, that's a really good point to my next question, which I want to put to you, Seema. From your perspective, what services do you think could help could help families with children with disabilities to either keep their child at home or to really successfully bring their child back from a CCI? What would you recommend?
As I am wearing a hat of a parent today, so with that perspective, I would definitely like to agree with Radhika ji. One is the awareness, understanding about the disability. Same as a parent in 90s when I had my daughter with me, I was not aware of anything related to disability and never seen in my life. So that was the case. And then lucky myself, I feel lucky myself because then I got in contact with the AIMS and Professor I.C. Verma, and then to ADI, the NGO. So that was the turning point for me as a parent. But yes, there is a need for awareness. Still, we find people, there are NGOs. There are still states where the NGOs are not able to reach. There are the places where still NGOs are not there to educate the community or at least the parents. So that is definitely one more thing. And for me, I always felt it would have been such a nice thing if in my education, I would have learned the normal milestones of a child, because that was my first child. I never knew about it. What should I expect from a child? Until otherwise a doctor shared it with me. So as you get a child, the next thing a family faces has to bear is the medical needs of the child. Needs finances to go to the doctors, do the diagnosis, take the consultations, take the therapies. So all that financial burden, all of a sudden, when it comes on a newly married couple, it really shatters you. So same thing, if I relate to my life, I gave up my job. I was working in a corporate at a manager level. I gave up my job, and to survive with a single salary was not possible with my daughter. So I had to do many more things sitting at home. Tailoring, putting up a shop, selling ready-made garments, so many things I had to do to cope up with the expenses. Then there was a burnout as a caretaker, as a mother who did not have continuous support system. And I will not hesitate to share here is that there was one point of time I might have committed suicide. But I came out of it. Tried to do whatever I could do. And to bring my child, definitely I had to educate myself, which I could do it with the help of NGO. They could educate me, they could guide me. And definitely till date, I feel we are socially isolated. Because of my great challenges of my daughter, we hardly can go into the social gatherings, to the events, in the society, and even from our family members. So those parents who have a child with disability, and as Radhika Di said, nowadays we call it benchmark disabilities, really have to give up many, many things. Why it occurs, right? This is a question, why it occurs in a family, why a family tries to see a shelter outside. Then once the child is there, is growing, then you have to think about the future. How much of finances you have to have for the child. Right now, I have to spend at least 5,000 for the diapers for my child, for my daughter. And the people are just earning 15 to 20,000 a month. They are the people in the category. How would they survive? So I'm not justifying that institutionalization, but I'm also talking about the systems which have to be there to support the families and as the child is born. So I'm also talking about those systems where, yes, now one of our participant had asked, what are the support services available in the country? So we do have support services now, which were not there earlier. Like for the awareness, there is a Rashtriya Bal Swasthya Kalyan Yojana, where early intervention and those therapies are provided, but they are very few, very few. They are not available locally for any parent to approach and get a long-term interventions. Parent training, right? Parents need to be equipped. They need to have the, what I would say, from stages of the child, have to be educated accordingly. When the child is in infantile stage, when it is adulthood, when it is growing old. So at different stages, the parents need to be trained to avoid the child going to an institute. A community-based rehabilitation services, yes. So these are certain services in finances also, or in health insurance also. Now the government has offered to senior citizen above 70, the Ayushman Bharat scheme, but it is not available to every person with disability who needs it so much right from the birth of the child. As Radhika ji said, they need assistive devices sometime throughout the life, and it has to change as the child grows in height and age. It's a continuous expenses. So whatever the pension, it has to be substantial for a person to live a life with all those extra expenses. This is the reason why parents find it very difficult to get a guardian who can take care of my child when I'm not there. People do not come forward because they know that there is extra finances involved. There's an extra care involved. I have to give up my job, my corporate life, 10 years to give to my daughter. So single salary coming at your home with all that extra expenses, it's not easy to cope up with.
We really thank you so much, Seema, for sharing both your professional and your personal perspective. It's very, very important that we're hearing from you today, and we really appreciate that. I think it's so important that you're mentioning really a diversity of services as well, from parent education and knowledge and organizations and services that share that kind of information, to very specific services like guardianship, or services that will help families to get that break or to be able to go to work. So really, really important, again, that you're sharing that it's a range of services. It's about accessibility to those services, bringing those services close to where families are. I'm really curious now, though, to go to you, Nipun, and just see, I mean, given that diversity that Seema has just described, no one organization can do this alone. And I'm really wondering how you recommend organizations of persons with disabilities be part of this work and this conversation, particularly when it comes to children, when it comes to families with children, and when it comes to really working for a better system of family strengthening and also alternative care for children in India. Surely it means partnership. What's your perspective?
Thank you so much, Beth, for firstly having me here. It's a pleasure being in this conversation. Radhika ji has been like a mentor figure to me for years now, and it's a pleasure to be sharing the stage with her. I think you've asked a very important question, and both from Radhika's comments, Seema's comments, and also the comments which have come in the Zoom chat. What I would like to firstly start off with is by talking about what I feel are the three challenges persons with disabilities face, and I think if we can overcome these three challenges, it's really overcoming these three challenges that organizations need to work on. The first is attitudes. I like to call them the three A's. So the first is attitudes. How do you really change perception around disability in India? Unfortunately, there still is a charity perception. The world has moved towards a social model. India's laws today are looked at through the social model, but the implementers, to a large extent, still look at them from a charity perspective. That a person with a disability is a bechara or somebody to be pitied about in that sense. The second A that I always talk about is accessibility. By accessibility, what I mean is that the policies and schemes are they accessible to persons with disabilities. When we are talking about inclusive schools, our conversation should not really start and end with a ramp. Is there a sign language interpreter like sort of that we have here interpreting in schools for deaf individuals? Are textbooks accessible to blind people through and it's easier today with AI, etc., to really convert them into audio formats, etc. But are schools doing that on time? And the third is, of course, affordability or the cost of living for a person with a disability. My heart broke, but it was not shocked when Seema ji spoke about how she had to sacrifice her entire career and stay at home to make her child grow up. I've had a similar journey as well. I was born with a physical disability called arthrogryposis. And I always say that my mother sacrificed 20 years of her life coming with me to school every day, ensuring that my notes are copied. And she totally missed out on her youth so that I could get a normal life. And it was because of her that I could eventually go to a normal school. And today I live independently in that sense. When you talk about childcare institutes, that's the second point that you really spoke about. I would like to say that, when a child is really young, especially in their formative years, I think it is crucial a child lives with their parents because there's a lot of social learning also that happens when you're living with your family, you're interacting with relatives, etc. There might not be all relatives that are really good. Even when I was a child, we actually had relatives who told my mother that why don't you homeschool Nipun so that society doesn't come to know that you have a child with a disability. These stigmas are real, but but at the same time, because I face such relatives, I became more thick-skinned. So it's important that children with disabilities also face society because eventually they have to be ready for society. Having said that, especially for persons with intellectual disabilities, there is a big fear, amongst parents that what about a child after we die? Who will look after a child? And when it comes to that, unfortunately, a lot of the government centers have really failed when it comes to delivery. Last year, there was this famous case of the Asha Kiran homes where a lot of people with disabilities actually died because of neglect by government authorities. But at the same time, the glass is half full as well. There are a lot of private organizations that are coming up, building fantastic rehabilitation centers. For example, I'll give you an example of one in Calcutta called the India Autism Center, which is a 50 plus acre campus that is coming up for people with autism who can live independently, when the parents cannot handle them in that sense, or the parents are too old, or the parents are no more. So things are happening, and that's why I said, but the glass is both half full and half empty. But we need to keep going and removing these three barriers, which I call the three A's for persons with disabilities. Thank you.
Can you repeat those three A's again for us?
Sure. It's attitudes, accessibility, and affordability.
Excellent, excellent. I think sometimes these easy ways of remembering what we mean is so helpful. And thank you for those perspectives. Really important. Seema, I'm going to come back to you now and just ask, like, really, really briefly, what's one thing that you want CCIs to know, charitable children's institutions, childcare institutions? What's one thing you want them to know about children with disabilities?
I would definitely like to share when we are talking about bringing children back home or children do not move to institutionalization. So one is the IC should do is do a comprehensive family assessment where you need to assess the age of the parent or the caregiver, the health of the caregiver or the parent, so that the entire burden comes on that, is there on that. So you have to assess whether when you send the child back home, is the person healthy enough to take care of this child? Or are the siblings involved? Can the siblings share the responsibility? Are they aware? Are they trained enough to support the family as a whole? And also one need to assess about the financial support system the family has. Because when we see practically whatever the schemes and benefits the government brings it out, the one category criteria becomes a family income. So it becomes a barrier to avail those facilities because it's not that everybody will contribute. They have to live. Every person has to live their life also. And when the parents are not there, then where is the income? Right? So those kind of things have to be seen whether they will be able to sustain the rest of the life of the child when you're putting the child back to home. What the family has a future plan, how can they plan? Guide them and support them. And first, before placing the child back home, you need to support the family by availing all the schemes, preparing the family financially and otherwise, so that once the child comes home, is easily adjusted at home, right? Then it has to happen and in a phasic integration, reintegration, right? So these are the things needs to be taken care. Then there should be follow-ups. Post reintegration follow-ups needs to be there. Because what happens later, who actually helps, how the child is being given a support, what is the family now facing, right? So because the child grows, the needs changes. So do they have emergency support system? Who is offering that to them? So there will be emergencies. Either the neighbors who are trained, who are aware. Is there an organization who can pitch in at emergency time at their home? The last is the child's voice. You should ensure that the child is comfortable and wishes what you are considering for the child. Because sometimes, as Radhika ji has also shared, there is a toxic environment at home also. Then we are not doing good for the child, then harming the life of the child. Yes, we do need some group homes. We do need such group homes in the community because there will be children who will be without parent. There will be children who might come from these broken families, right? But we need to have a very strong, like minimum standard system for the homes, which as a group of organizations, we had come up with Parivar also. And now we have created a consortium in which we are going to each other's home and we are assessing. And we are going to support them, whatever they need to improvise into.
Yeah.
So these kind of support systems, parent support system or community support system should be created.
Great. I think also just this important point of really beginning with good assessments and really understanding the children in the families. That's really an important point that you're making. Radhika, we have a lot of professionals on this call. This was a webinar for people who are very much doing this work and trying to improve their own professional practices. Really briefly, what's one key message that you have for professionals who are specifically working to help CCIs to transition to family services? You're on mute. Perfect. There you go.
I think for professionals, I think the main thing I'd say is just remember that she is a child, because I've met many professionals who work in CCIs or who work in the protection arenas, and there is this kind of hesitation because there's this feeling that this is a very specialized area. And I think in the ways that we are, if we start with the child and all the things that children need, those are things that you don't need to be very specialized with. You do need specialized services. I'm not saying that. What I'm saying is that as a professional working with children, perhaps in a CCI, which has many children with disabilities and other children, to remember that she is a child. So if you start with that, many things will become easier. The other thing is, let's create some SOPs, with children lying down all the time in a room or on a cot, day in and day out. Those are practices that we have seen in season and, so I think it's also time that we can educate ourselves. So that's the one thing I would say.
Great, thank you. Absolutely. Taking me to you, Nipun, for some very similar question. We have a lot of professionals on this call. It's been pretty theoretical, the conversation. What is just one brief practical tip that you want to share with people who are on the webinar today in terms of caring for and working with children with disabilities?
Firstly, I think being curious about the child with a disability and as a child itself and not the disability is something which is very important because that humanizes the child. So, and I always say that even a person with a disability has multiple identities. So don't just look at the disability in that sense and start looking at the complete human being. Once you start doing that, you will automatically shift from sympathy to empathy, which I think is something which is extremely important. Secondly, from a policy angle, I think where India is really failing at the moment is in truly identifying and certifying disabilities. So getting in the medical experts on board to understand what is a disability, ensuring the person with a disability is disability is certified, and you know what disability it is, so that you can work backwards from there is something which is extremely important. I'll give you an example. The Union government a couple of years back launched the UDID card, the Universal Disability Identity Card. It is shocking that only around 1 crore people today have the UDID card in a country which has, 1.3 billion people. We also have a census which is coming up next year for the population of for India's population in general. The 2011 census only estimated 2.21% of India's population as disabled, whereas WHO says that 16% of the world's population is disabled. A major reason for that is that a lot of disabilities don't really get declared or recognized, and there's also a big social stigma around disabilities. And I think getting in the right medical professionals will also help recognize what are the invisible disabilities. Because when we talk about disability in India, a lot of the conversation gets hijacked by people with locomotor and visual disabilities, and the other disabilities get forgotten in that sense. There's a saying often, that people start thinking that a person, and it's a derogatory word to say it, but people start saying that, ye to pagal hai, or this person is mad, without realizing what is the intellectual disability and how we can work with that against that person. Which is why I think empathy and the right certification are the two important things to take this conversation.
Very practical. Thank you so much. I think that's really, really helpful. We have a little bit of time left for some of our participant questions. And I actually want to start coming back to you, Radhika. Excuse me for looking at my phone just a minute, so I'm sure to get the questions right. One of our participants is curious, is the RPWD Act synchronized enough with the articles of the UN CRPD? What's your opinion on that?
It is synchronized. It is synchronized quite a bit. But of course, it's not, totally synchronized with the UN Convention. But there is a lot of the RPWD Act very much often just taken from the UNCRPD, actually. So yes, I think if I look at it in terms of where we were and where we are today, I would say, because I don't think there would ever be a situation where any law would be totally synchronized with the convention, because it's a very wide thing. But I think, yes, we've come pretty far. If we could do all the things that are there in the law, that would be a big change.
Yeah. So it really comes down to implementation, which I actually think is such an important point to this next question, which I'm wondering if you might respond, Nipun. this question is, could you give us some idea of the newer services needed to really bridge the gap between the mandate of inclusion? So to me, that's the law, right? And on the ground services. So some of the newer services that you feel like would help to begin to bridge that implementation gap.
I'll come to that, but let me answer a brief question about the RPWD Act as well. I think on spirit and on paper, it is totally in line with the United Nations Convention for the Rights of Persons with Disabilities. But when it comes to implementation on ground, I think a lot has failed in that sense. Last year in November, the Supreme Court of India, actually in a historic judgment, which is called the Rajiv Rastogi judgment, actually struck down all the accessibility provisions in the RPWD Act because they said that they were advisory and in nature, and we need to actually mandate accessibility. Accessibility standards have to be mandatory. And the government actually was given 3 months to come up with new standards. 3 months have passed, the standards are still being made as we speak, and I'm hopeful something better will come up through those standards. Secondly, there's also a lack of harmonization of laws in India. For example, there's this National Trust Act, which I assume Radhika ji must have touched upon in her presentation, that spoke about substituted guardianship. The RPWD Act, to a large extent, went away from substituted guardianship, and you spoke about how guardianship should be complementary in nature and how the persons with disabilities should have the final agency when it comes to anything. Having said that, the Data Protection and Privacy Bill, which came up in 2023, the rules for the bill came up this year, actually again started speaking about substituted guardianship, where a person with a disability cannot even, do anything online. Just like ordering a burger on Zomato also would be violating the act under this new provision because everything really in terms of releasing your data is up to the guardian and not up to you. Similarly, there's an income tax bill that has come up for discussion in Parliament. It actually refers to a Persons with Disabilities Act 1995 and not the Rights of Persons with Disabilities Act 2016, even though the 1995 Act has completely been replaced by the 2016 Act. So there is a big lack of understanding amongst other ministries about the RPWD Act. Last year, I was on a panel with the former Chief Justice of India where he started talking about how he's facing a challenge to find a home for his 2 daughters who are on wheelchairs because he's not finding an accessible home for them. And if the head of the judiciary of a country is facing a challenge in the capital of the country, you can imagine what the situation in the rest of the country is. And that is because the Ministry of Housing and Urban Affairs does not think about disabilities perhaps as much as anything else. And that's what we need to realize, that disability is such an intersectional issue that till we do not have group of minister meetings where every ministry has a disability expert and every ministry is looking at disability, the problem around disability will not go away with one act, one law, or one department working on it. And that is what needs to change. So I know you asked me a question on services and I moved away to policy in that sense. But in services, I think every new age service really needs to look at disability. I'll give you one basic example because I know we are short of time. For example, Uber in the United States, I know you are in the United States of America. In most states today is legally mandated to also have vehicles which are wheelchair accessible. In India, Uber doesn't have a single accessible vehicle in any state. They started it in Bangalore with CSR funds by a corporate and they've shut it down there as well, unfortunately. But it needs to become mandatory for the private sector also to look at accessibility because we can't just keep, kicking the government on that, especially in a capitalist world where the private sector is taking in more and more space in the country and its economy.
Thank you so much. I'm going to really quickly respond to one question that was in the chat about parents who might have a disability and who want to adopt. Just speaking from a global perspective, disability itself is never a reason to assume that someone couldn't parent for any reason or couldn't be an adoptive parent. And this is again coming back to what Seema shared. It's about really good assessments, understanding the family as a whole, understanding whether they have the supports that they need to bring a child into their family. So again, I think we're never looking at disability as a primary reason for a yes or a no when it comes to adoption, although again, awareness is really important. Somebody's just put in the chat that sometimes people are rejected, we think because of their disability, not a reason to be to be rejected, but certainly that points to that ongoing need for there to be good assessments and a lot of awareness for professionals, just like all of us on the call today. Just as a final question, there is one that has just come into the chat. Working with CCIs and DCPUs, officials, they may have masters in social work, that's a MSW, but they really lack knowledge and sensitivity towards children with disabilities. The communication between CCIs and children is not really happening. What do you think can be done to improve this, especially for people who are already having a high degree in social work, but maybe are still not understanding disability or not able to practice when it comes to inclusion and considering some of the things we've talked about today. Seema, what's your suggestion for someone who has a master's in social work already? How do they continue to learn?
Yeah, I have an experience in the organization. Masters in social work definitely touches upon the disability. They might name the disability, but it is not taught how to work with them. Because even we had employees from TIS last year, 2 years back, but we had to groom them on disability. So that was one feedback I gave it to them. If you say it is the disability studies, then they should learn how to at least interact and intervene about their needs. So that is one lacuna in their training, actually.
Yeah, good point. So really looking at university level training, maybe even practicum or practical training, and how do we bring disability into that more? Excellent. A lot of work to be done there. Any final comments on how again, I want to keep it really practical for people who are on this call. How do we sensitize government officials, ministries, and policymakers about disability? And I want you to keep your responses very short. Let's go to Radhika first. What's one practical tip about how people can sensitize government officials?
Firstly, just like to say that please look at the JJ Act. It does not see parents with disabilities as competent parents. So please do look at that. That is where this whole thing is coming from.
Mm-hmm.
They have to meet people with disabilities. They have to work with people with disabilities. That we have to see that's the only way.
Yeah, so that exposure, right? Coming out of our discomfort zones and leaning in to those conversations, to the exposure, even in our own communities or in our own families. That's the beginning point. I think that's really important. Maybe there's ways that we can provide those kinds of opportunities to officials. I'm a little bit watching the clock, so I apologize for that. I know that everyone who's on the call today would love for us to continue this conversation. I hope that we can find ways in the future to do just that, because your insights, Seema, Radhika, and Nipun, are so important, and really the beginning of us all having more exposure and continuing our learning. I hope everyone who participated today is taking away one small thing that they can do next. And with that, I really thank you for joining the conversation, for your honesty, for sharing your personal stories. And I'll turn back to you, Kavita, to close out our session today and tell us what's coming next.
Thank you, Beth. And you very rightly said we really don't want this session to end, but we have already been extending it. I think while listening to everyone, like listening to you, Radhika ma'am, Seema ji, and Nipun sir, everyone, I think we have come so far, but also we have to be mindful that we have not traveled so far to stay here only. There is a long journey to cover, and we really need to learn a lot, unlearn, and then relearn also. This is what my learning, and I hope everyone agree with me in this. But yes, on IACN behalf, I can just say that this is a beginning for us. We are also looking, we can also come up with more sessions on disability. As Radhika ma'am and Seema ma'am and Nipun sir pointed, information lack is one of the biggest challenge that parents and professionals face when they come across and when they have to deal with a child or manage a case of a child with disability. So one thing that we can do on IACN is to create that platform for information sharing. So everyone, again, thank you so much for joining us today, all the participants, and staying us till the end of this session. And a very special thanks to our both interpreters, Tuti and Saurav, for their continuous effort on interpreting the language. Radhika ma'am for the wonderful session. Seema ma'am for sharing your personal journey and your professional journey with us. Nipun sir for giving very practical information, very practical, and also I think the 3 A's will be the one of the biggest learning everyone will remember. Thank you so much, Nipun sir, and Beth for the wonderful moderation. And I know you have been a very big source of support for IACN when we talk about transition. So thank you, everyone. Thank you so much. Thank you all the participants for joining us today and making this event a successful and a very enriching event for everyone.